how to stretch the hip flexor, because you'll get to that. These are different types of stretching, different technique stretching. Okay, then you can apply that to any joint, muscle, XYZ. Okay, so adductor MET is the most common, right? So we want the insertion to go closer to the origin, so we're going to block at the insertion, which is going to be down here. So I'm going to hold here and I say squeeze, and that's an SI joint pelvic mobilization. All right, that's muscle energy technique. Easy, right? You can do it at the shoulder, say for the lat. So go ahead and push, block. Right, so now it's moving the shoulder inferiorly. Right, so somebody has an excessive superior glide, you can use the MET to suck that thing back inferiorly. Okay, what's next? Now they don't have my slide behind me. Pin and stretch. Okay, so pin and stretch is going to be upper trap. So I have you sit facing that way. Right, I have UT right on there. UT is upper trap. Okay. Yeah, you go that way. You go that way because I'm going to do it from posterior. So normally I would do this like this. But for demo, I'm going to do it like this. Okay. So upper trap lives right here. That's fine. Tight for most students in PT school. Right. Most people sit at a desk. Right. So this is a great one to do pin and stretch. So you're going to pin the muscle. So you find a trigger point. Right. You guys know what a trigger point is yet? Right. A taut band. Right, it's like the knot along a top band. Okay, so upper trap is nice and tight, so you can either pinch it, right, get in there and like squeeze it, right, or you can pin it, right. So a lot of times if you can't squeeze the muscle, upper trap is great to pinch it. But if you can't pinch it, you can't squeeze it. You just push down, pin it down, and then you stretch it, and then come up. Right, so you gotta pin it down, stretch, hold, maybe count a few seconds. Come back, all right? So this is what it looked like in the clinic doing it. That's nice and easy. Hold down, stretch, come back. Okay, the next thing I want you to look at is in her motion, right? So go ahead and side bend. See where she gets her motion from. What joints in her cervical spine are moving when we do this? Mid, upper, lower. Upper, right? Mostly upper, okay? So we want to be careful of that because we're going here and we're creating a lot of hypermobility in the upper C-spine and not actually getting a good stretch on her lower C-spine. This is why I don't do it this way, because now I can only control her head. I would get in here and I would go lower. You want to get the upper trap attaches all the way to the skull, yes, but it has more attachment down here. So I'm going to block and stretch from down there. On pin with my first MTP, find the trigger point, right there, boom, and then I'm going to stretch down here. So now, even though her head is still getting a lot of upper cervical side bend, I'm getting a lot of more stretch in the lower cervical, where she's restricted. Hypermobile here, hypomobile here. So when you're doing a stretch, you want to make sure you get the stretch to the hypomobile area. Right? Not more of a stretch that time. Or you're just doing your head, right? Because your head can just flop. It's not even stretch. Right? Okay, so that's pin and stretch. You can do it anywhere. Supine, do it real quick. I do this in the pec all the time. Okay, so pec does horizontal adduction. To stretch it, you're going to do horizontal abduction. We're going to come right in front of your shoulder. So you go just medial, inferior to the humeral head. Pin it down. Snap it right over and stretch. Okay. So again, pin it down, stretch. So you get a good release on the trigger point at the same time you're lengthening the muscle. Killing you, right?
So I just can't feel my hand now.
Yeah. All right. What's next? Let's have the pin and stretch. Active release. Active release is the exact same thing except you have them move through it actively. So you show them the motion. This is what I want you to do. Ready? Go ahead. They do it. You're like, okay, good. That's the right motion. Relax. 1 second. You find the trigger point. Hold it. You say go. When they contract the muscle, you push down. And when they stretch, too fast. So when they go out, you relax the pressure. Now when she contracts her pec, press on it. Now you let it go. Relax. press on it, contract. If relax, active, release. Pressing, that's the release part, active. Relax.
How do you find critical?
So yeah, it takes time developing your tactile skills. So basically, you're looking for a taut band. So you're looking for a tight muscle, short muscle. Yeah, tight muscle because it's got trigger points. And then you're gonna find like little bumps, right? Do we have so you're gonna look for the area that has. So you're looking like a muscle, right? And then you're looking for like these little balls in there. So you're gonna you can slide your fingers, do this with someone's upper trap when you go to your lab, squeeze through and you'll find you'll hit a rib that's like a little bit harder than the rest. That's your trigger point. Hold that and then stretch. In the beginning it'll be a little bit hard to necessarily find it, but the more you do it, the easier it gets. Yes.
For active release, is the concentric is active, but the eccentric is passive?
No, it's all active just when you're pressing. Okay, so pec does horizontal adduction, right? So when she's adducting, press, go ahead. Now I release, go that way.
Oh, you
Press,
don't
go
bring
ahead.
it. You don't bring it.
Yeah, come out. Usually I do it if I'm doing with somebody like their arm, I'll do it with them, but I'm just guiding. I'm not really actually moving their arm. Yeah. Good? What's next? Okay, glides, right? Glides versus tensioners, right? Okay, so sciatic nerve is going to be our example, right? So tension position of the sciatic nerve. Okay, finding end range here. Okay, right? So I'm going to take one joint off, right? The only thing I did from here to here was I took off her, right, the tension at the knee. Right, and then now I'm going to move two joints at the same time. So I'll choose the foot and the knee. So now I'm taking tension off the nerve at the ankle, tension off the nerve at the knee, tension at the ankle, tension off at the knee. That's the glide. That's the floss. That's the intervention. Okay, do the same thing at the hip, right? So we can go here. So the two joints I can pick could be the hip. So I can take it off at the hip, and then I can do knee and hip. Right, you can pick any two joints you want, right? So there's no nerve tension here because we got the knee taken out. There's no nerve tension here because now we took it out from the hip. So you can do any two joints along the chain, right? So in upper extremity, sometimes I'll use the cervical spine, right? So if it's a cervical radic, it's easy to have them just side bend away. You teach them how to side bend, right? So then while you're doing the floss, you can kind of just guide them on the side bend, kind of rotation motion. Do the floss at the neck. So you want to do the floss at the joints that where you suspect the nerve is most restricted. Right? So carpal tunnel, you're going to do wrist. Cervical radiculopathy, you're going to do the cervical. Sciatic nerve could be like piriformis syndrome, you want to do the hip. Okay. Next. Oh, and tensioners we saw was just just tension the nerve and then back off. Tension the nerve, back off. You do it to their tolerance, but don't use this technique. And then when it tingles really bad, you're like, okay, relax. That's not tingling so bad. Do it again. Tingling real bad. Okay, relax. That's a tension. Not as effective. The patients don't like it. The glide should be painless. You shouldn't have the tension, the paresthesias, and the burning sensation when you're doing glides, because you're not tensioning the nerve. Right, once you find that tension position, the tension comes off for the rest of the intervention. Okay. Next.
Range of motion barrier assessment.
Right, so that's what we went over before. I'll use your ankle. Right, so if she has limited dorsiflexion, let's say, right? So it could be limited by joint. Right, so you guys are learning lower extremity. Directional glide to increase dorsiflexion is going to be a posterior talar glide, right? Talus needs to glide posteriorly when the foot dorsiflexes, right? So I can put her in that end range position, induce the correct directional glide, and then see if it improves. If it improves, let me know it's limited by a capsular restriction, posterior glide, right? posterior capsular restriction, right? Because I glided the joint, I forced it to move, and now it moves better, right? If it's muscle, if it's her gastroc, she's gonna go to here. I'm gonna induce a glide, and I'm gonna get like maybe a little bit more, and it's gonna be springy. I'm gonna feel it bounce, right? That's gonna be her calf, right? And if I get her here, and it's and actually I have a good video of I had a patient coming in. Let's see if I can get it up in between switching. She had cervical radiculopathy, and so we're doing her median nerve glide, and I'm testing. I'm like, wow, that's really limited elbow extension, like a normal person, right? It's like not normal to walk around with your elbow not being able to straighten. So I took her out of the tension position, and I was able to straighten her elbow all the way. So that's a dural, that's a nerved range of motion barrier by nerve. Right? If I put her in the nerve tension position, I could not extend her elbow any further. Then when I brought her down here, where the nerve's no longer on tension, her elbow straightened out all the way. So that would be the range of motion barrier by nerve.
So you're doing nerve glide.
The intervention for that would be a nerve glide at the elbow. Okay. And obviously the interventions over here would be to keep inducing the glide. We do the appropriate dosage for joint moves, which is not covered in this class. And then if it was gastroc, it's muscle, then you stretch it. Easy. Right? Good? Okay, next.
Static stretch.
Static stretch, hamstring, hold it. Boom, count 30. Do it 3 times. Done. Next.
Cyclic stretching.
Cyclic stretching. So I like the hamstring cyclic stretching actually. So you're gonna hold on your hamstring. So what I want you to do is keep your knee towards your chest, and now try to straighten your knee, but don't let your knee come away from your chest. Good. And then go back. Do it again. Hold it. 3, 2, 1. Relax. Come back. Oh.
Okay.
Come back. Let it relax. Actually. Now go. 3, 2, 1. Come back. Let it relax. Go. 3, 2, 1. Come back. Cyclic stretching. So you do it enough times, and it goes to 2 minutes. Right. So when I give this intervention to a patient, I'll literally just put a timer. 2 minutes. Keep doing that for 2 minutes. Okay. So that'll be a cyclic stretch for your hamstring.
Ballistic stretch.
Ballistic, we went over that last time. That's like when you go to the end range and bounce. So let's say this was her end range. I'd get there and I would do this, right? Not controlled. Even I'm trying to do this as controlled as I can, and I'm getting like a little hip rotation, right? So that's why it's not really effective, right? Don't do that.
PNF.
PNF. So then we have the 4 categories.
Yep, you have shoulder, ER,
Okay.
IR, HS.
Hamstring. Okay. All right. So yeah. So I use PNF a lot of times in the shoulder to improve external internal rotation. Okay. So the first one we have is agonist contraction. Correct.
Hold the one.
Hold, relax. Okay. So hold, relax. It's gonna be. I should get the PowerPoint up too. Someone pull up the stretching PowerPoint for me. Okay. So hold, relax. So if I'm trying to improve her external rotation. You guys now remember what the normal external rotation range of motion is? 90, okay? So 90 would be right here. Okay, you're good? Your shoulders okay?
Yeah.
Okay, good.
I can go farther.
Okay, good. So this is 0, 90, right? Let's say she's at like, what is that, 45 or so, right? So if I'm trying to improve her external rotation, a PNF technique that I can use is using that reciprocal inhibition. So I want her internal rotators to relax so I can stretch them, right, by externally rotating her shoulder, right? So if I want her internal rotators to relax, I can have her contract her external rotators. I'm going to say push into my hand, relax. Now I'm going to push. Oh, you didn't relax. Okay, new patient. Push into my hand, relax, and then I'm going to stretch it. And then I say push into my hand, relax, and then I'm going to stretch it. Push into my hand, relax, and I'm going to stretch it. Right? Hold and relax. Right? So I'm having her hold the opposite muscle is that we can stretch, we can relax and stretch the other one. So by contracting her ER, it forces, it's physiologically not possible for her to not relax her internal rotators. So it's also a good technique for tight muscles. What do we need to do to a tight muscle? Relax it. So you can use PNF, hold and relax. So relax and stretching it at the same time. What's the next one? Contract, relax?
Yeah.
Contract, relax is going to be the opposite. So this is going to be a concentric exercise. So now I'm going to use her internal rotator. So we're going to start at her end range, which we'll call it here. So I'll say push into my hand. So concentric, 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 relax. And then we're going to stretch. Hold it, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Push. Relax. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Push. All right, so that's contract, relax. Contract, what is it called?
Yeah.
Contract, relax. Okay, so contract and then relax. Okay. And then we have agonist. These are the ones that always give me a trouble. Agonist, what is it called? Say it.
Agonist contraction.
Agonist contraction. Okay, so this one I use it more at the hip. Okay, to free up the hip joint. So, closed pack position of the hip. You guys do this in Goni. Are you guys in lower extremity Goni right now?
Yeah.
OMG. Okay. Closed pack position of the hip is hip flexion, internal rotation, and adduction. Right. So many times, if you're getting like someone with a hip OA, right? So that's pathology of their hip joint. The closed pack position is not going to be a fun place for them. So you're going to get to here and they go, ow, they get a pinch right in their groin. Right? You're going to find when you get to hip groin pain is joint pain. So you say, ow, I have pain right there in my groin. It doesn't go any further. I'm getting a little resistance, right? Because I'm hitting the edge of the joint, but I'm not getting a springy feel that I want to stretch, right? Remember we talked about the limitations, right? So I'm getting like pain concurrently with limitation. So I'm a little bit funny about stretching. That's when we just want to start initiating stretching, right? So this is a great place to use PNF. And so I'll use them to contract so your psoas muscle, I'm going to push it in your psoas, lives outside your joint. But when it's super tight, sometimes when it's on slack, it starts to fall into the joint and can get pinched. Find out later in the semester that's called impingement syndrome, right? And so to get it out of that joint, you can have them contract it. So go ahead and push into my hand right here. And now she's contracting her psoas. We're just going to pop it out of the joint. And now relax. Now I'm going to increase the motion. Now I say push. See how I took?
It's just cramping right now. Sorry.
Okay, relax.
Okay.
She's holding it. All right. So you got to be careful with your manual contacts when you do PNF, right? Because if let's say I'm holding her leg, if her leg was a little bigger, harder for me to control, and so I'm kind of holding it here like this, and I say contract, pushing my hands. She knows because she knows I want relax. She knows I want her to contract her psoas, but if my hands are like this, she might not know if it's here, right? Which way to go? Now I'm just giving some distractions so she can relax her. Okay. So the intervention that we're gonna do is agonist contraction, right? And so you're gonna have her push and relax, push and relax, push and relax. And we're going to increase the range of motion that way. Okay? All right, and the last one is a long one, right? Agonist.
Hold, relax against agonist.
Yeah, against agonist. So this is the same thing as the manual one that I did over here, except it's all her. Okay? So it's hard to see with the shoulders, so that's why I'm using the hamstring. So have you sit facing that way.
Sitting.
Off the
Legs
edge.
down?
Yes, thank you. Okay, so if we're trying to elongate her hamstring, she's going to first contract her hamstring, right? That's the agonist contraction, and then relax, and then she's going to kick and use her quad, right? And relax. So the first technique, the second technique would be would be that she would do She would do this motion, so push into my hand. Go ahead.
Oh.
Concentric, and I would say relax, and then I would pull. Push into my hand, relax, and then I would stretch her hamstring. Right, that's that second technique that I did earlier with the IR. The only difference between this one is it's all her. She's gonna push, go ahead, and now kick the other way, and now she's gonna use her quad. Then she's gonna push that way, and she's gonna push that way. So we're getting that reciprocal inhibition, that on-off phase in the muscles to help stretch the muscle. Okay. Cool. Good. That's it, right? Yeah. Okay. So